I believe that Dr. Janet Eddy is a Richmond history maker because she has really dedicated her life to caring for the uninsured and has worked very hard at also creating a safety net for people who are vulnerable in our community. Over the years, her professional life has really been dedicated to caring for those, not only for those who are uninsured, but for those who are underinsured or those who have lack of access to health care. Dr. Eddy has also spent a significant amount of time working, I think, diligently to try to overcome barriers to health care within Central Virginia. And you know, many times barriers to health care is not just being uninsured. It's areas like the need for transportation, language services, access to specialties. Since she has been the medical director of our care van, she came in 2009, the number of patients visits that we've had has increased significantly. In 2009, we were seeing probably about 8,000 patient visits per year, and now this year it has increased to over 18,500 patient visits, purely under her leadership with a wonderful staff that cares for the patients who come to our care van.
I think it means empowerment. I feel like I have had some power in creating some change in Richmond. And I guess I really want to say we, because it's been really a big group of us who kind of looked at the situation in Richmond a couple of decades ago and said this isn't fair. And what wasn't fair was the fact that there were so many people who couldn't get medical care because they either didn't have insurance or they didn't have money. There's been some real power at work. I've been a really small part of that, but as a community, all of these organizations and individuals who have volunteered have all worked together to take care of people who don't have medical insurance or the money to afford it. I think the next couple of years is going to be really interesting because we have the Affordable Care Act coming in. We don't really know exactly what's going to happen with that, but what we think is going to happen is that many of our patients will have insurance, which has been kind of a decade-long dream of a lot of ours. But there's still going to be gaps, and I see myself working within the gaps once we figured out what those are. And probably working in an alternative type clinic with immigrants and people of low literacy and low medical literacy. That's probably going to be my niche.